You're listening to the MPD Connect Podcast, hosted by Public Information Officer Tim Aycock.
So thank you so much for being here. I appreciate you taking time out of your day. Just tell us a little bit about yourself and about Pat's Place.
Absolutely. I'm Mary Kathryn Elkins, and I'm the Director of Healing Services at Pat's Place. So I'll talk a little bit about what Pat's Place does for our kind of traditional Child Advocacy Center services, and then what my team does. So Child Advocacy Center model was created in 1985 by the district attorney in Huntsville, Alabama, who was really frustrated by the lack of coordination between the different investigative partners and schools and medical personnel that were working with children. It wasn't a very trauma-informed system because children had to tell the story over and over. And if you've ever known a young child, you know, they are very emotionally attuned oftentimes. And so if they were telling the information of what happened and they noticed, you know, at this point in the story, mom gets sad, then they may adjust that part of the story so that other people's feelings, you know, aren't hurt. So
Trying to protect people.
Yeah, trying to protect people, and so it becomes not super credible. So for court, you know, the testimony of the child becomes less credible. So this guy in Huntsville, Alabama, created this model that allows children to tell the story one time. So they come in once there's been a disclosure. Whoever they disclose to, whether it's at their school or a social worker, knows not to ask more questions and to just get them connected with law enforcement. All the referrals that come to us either come through law enforcement or DSS. They come in for an interview with a trained provider who is trained in an evidence-based interviewing protocol that's developmentally appropriate, so they know kind of, you know, if a child is 5, they can probably give us this and this type of information. If they're older, they can fill in even more blanks, so they know what types of questions to ask. The investigators are there to observe the interview in another room. The parents receive advocacy services with one of our family advocates. They also have access to medical services while they're on site, so they can have a medical appointment with a nurse practitioner who's trained in forensic medical services. And so the interview is recorded and is admissible in court. So in Mecklenburg County, we've been around for about 20 years in Mecklenburg County, and we've seen the percentage of these types of cases that are charged go from about 5% to about 95%. So wow. This model is really effective. It is sort of based on this cornerstone of a multidisciplinary team and partnership, which you all are a part of. Right. The other law enforcement entities in the county are also part of, as well as Atrium. They provide our medical services, our DSS social workers, CMS schools, and mental health clinicians are also part of that MDT. So we're able to all work together to make sure they get services. So then once they've come through for those types of services, my team sort of steps in for what we call the aftercare services. So we provide clinical mental health and case management for children who are at high risk for human trafficking. We have a program called the YES program that does that. And then we also have a network of clinicians in the community who have been trained in different trauma modalities. So they have this advanced clinical training. We've vetted them. We've made sure, you know, their license is in good standing and all of those kinds of things. And then we can make referrals for families to those services. And then finally, we have our prevention specialist who does education, workshops, and trainings all throughout the community.
That's really, it's very extensive, and I think, you know, a lot of people just don't realize what all you guys do. Because our detectives, I've obviously been working with you all for years, and I hear them talking about it all the time about what a key resource it is, and they couldn't build their cases like they do now without you guys. And just knowing that you have the aftercare for them too, because that's one thing for the child to go through that trauma, and then, you know, what happens after they've done this court process and everything. So to make sure they have help on the back end is tremendous.
It is, yeah, and we've really tried to fill gaps. I think one of the things that we are really good at is being innovative and also resourceful. So we're able to do a lot with, you know, relatively low resources.
Right.
And so I think just having a really creative team who is also really dedicated to the work, we've been able to develop new programs and just make sure that families are getting a lot of their needs met.
So speaking of that, about low resources, how are you guys funded? Is it donations or is it grants?
It's a combination. So it used to be a number of years ago that a lot of our funding came from federal, state, and county sources. Some of it was pass-through funds. The Victims of Crime Act, VOCA, which I think this is really interesting, and a lot of people don't know this, so I'm going to talk about it for a second.
Yeah, absolutely.
So VOCA is funded at the federal level by fines that are levied against white-collar criminals. So the last huge settlement they had was the opioid settlement. I don't even know when that was, but years ago. And so that filled up VOCA. And then each state gets a distribution of that annually as part of the federal budget. And then those states have different ways of allocating that money. So victim-serving organizations get a cut of that. Sometimes it's a competitive grant, sometimes it's a formula grant, sometimes it's a combination of the two. So we received quite a bit of VOCA funding over the years, just like a lot of other victim service organizations when that account was full. But over the years, as white-collar crime hasn't been prosecuted quite to the extent that it, different administrations approach it differently, that money has dwindled because it's not set up to be supplemented by any kind of regular budget allocation. So the amount of VOCA dollars has really shrunk, and so that's hurting organizations like ours because that was a big source of income for us, or revenue for us. Right. So we've adjusted our approach over the last few years, kind of knowing that was happening with VOCA and being aware of all of that. And so we now have a more diverse funding bucket. So we have individuals who are very generous with us. We do a couple of great events throughout the year that raise money. We apply to lots and lots of grants for private foundations, corporate sponsorships, and donations. And then we still have some of the government grants.
Because you are getting ready to go into a new facility shortly.
We are.
Right?
Yeah, it's so exciting. About we hope a year from now. They've started construction, so it's underway. We're moving into a building that will be called the Umbrella Center, which is a family justice center model. That's another kind of national model that's been adapted over, it shows up slightly differently in different jurisdictions, but the full model brings together the domestic violence agencies, which for us is Safe Alliance, and the Child Advocacy Center. It puts everyone under one roof. So in Mecklenburg County, we'll have our law enforcement partners there. We'll have our DSS special victims investigators there. We'll have Safe Alliance, Pat's Place, and lots of other services. We'll have a medical facility. We'll have a food pantry. We'll have economic services will be there. We'll have lots of clinical services available. So it's really going to be incredible. It's going to be right up the road off Independence on Albemarle Road. Right. So you can drive by and see construction right now. It's right there, and they've got the fencing up so you can see which building it is. But they've been working on it, I think, for about 10 years, raising money. And, the cost is a moving target with how, the price of construction materials have fluctuated over the years. But it's really exciting that we're on our way. We're counting down. We've selected furniture. We have lots of committees going to, plan operations and all of that. So it's happening.
That is exciting to be that efficient finally, to have everyone under one roof. That is very good.
Yes.
So where could they go to donate? Can just, say if I'm just Joe Citizen, can I donate myself?
Absolutely. On the Pat's Place website, which is patsplacecac.org, there's a donate button, and we welcome gifts of any size, $5 to $5 million. Right. There's also a website for the Umbrella Center, so if people are drawn to that project, they can donate there as well. We welcome donations. We also do quite a few kind of material drives. So children, when they come in, receive a small toy or a stuffed animal when they come in. So we're always accepting, games or stuffed animals. We have some people that bring us blankets because the kids love to have a blanket when they leave. Snacks. Sometimes families are with us for 2 or 3 hours, and if there's multiple children, it could be 5 hours. And so we try to make sure that they have healthy snacks and water and coloring supplies and all kinds of things like that. So if people prefer to give items, we're always happy to collect those as well.
Right. That's very good. So how many kids on average do you think you're helping? Yeah,
we serve about 1,000 kids a year. Most of those are coming through for our traditional services of the forensic interview and the family advocacy. We also do what are called community consultations. So if you, for example, were involved with a family through your police work, and they didn't quite meet the criteria for an interview with us, but you knew they needed some services, some therapy referrals. You can call our chat collaborative, and the specialist there will do a consultation with you to find out the information. They'll look at the zip code, they'll figure out which providers are nearby and easiest to get to, and take the family's insurance and all of those things, and help connect them to services. So we serve quite a few kids that way. We also have some children that are referred directly to us for clinical services. We do a group for problematic sexual behaviors for school-age kids, for 7 to 12-year-olds, and so we have children that are referred directly into that program. So they're coming from multiple places. We also have a really cool partnership with all of the law enforcement entities in the county called Handle with Care, which is something that is building momentum and will be another place that will be able to turn attention and provide services. So what that does is it allows patrol officers, when they respond to a call and a child is present on the scene, they can make a secure report through a web portal that we've developed just for law enforcement that sends the child's name and age to a small group of school contacts at the child's school, and just lets them know something happened, handle with care. There's no details of the call, there's no details of what happened, but it just lets the school know that something happened to that kid outside of school hours, and they can be more trauma informed with their response. So we're the holders of that data, so we're able to see, which schools are getting the most reports, which divisions are making the most reports, and to kind of target efforts in those areas. So we're not excited that those calls are happening, but we are excited to have a little more insight into where trauma is happening, and to be able to reach out to those schools that are getting a lot of reports and to support them.
Just even think about that back-end connection of that resource. That's pretty amazing in itself.
Yeah, and it's great for the officers too, because I'm sure, you've responded to calls, and we hear from so many officers where the child sticks with them, and they hope that they don't fall through the cracks. But as a patrol officer, you're moving on to the next thing, but the child may kind of stay in your mind, and so this lets you know that they are going to be connected to someone who's going to have eyes on them. The schools are tracking grades, behavior, and attendance over the course of the year, so they know, how the child is doing and how they're performing, and what types of support they need.
That's good. So kind of thinking on the bad side of that, what if you weren't here? What if Pat's Place wasn't an organization area? How fortunate and blessed are we in this area to have an organization like that?
Yeah, I mean, of course, I believe that our services are invaluable, but I think we can go back to that statistic that I shared at the beginning, which is, prior to the CAC model, the number of cases that were actually charged and prosecuted and convicted were so low. And so you imagine a community where children are experiencing trauma at the hands of adults, and those adults are not, nothing's happening. There's no repercussions. And so I think without the services that we do, and without the investigative piece, there would be a lot more perpetrators that were kind of, set loose. And so I think it's a really important piece of, supporting law enforcement, but also really to get those families in the door to services. And we say all the time, it's okay if there's not going to be, a court outcome. That doesn't happen in every case. The goal is to get the kid in our door, and once they come in through the door, we can connect them to all of these amazing resources. So
get as much help as possible.
Yeah,
because that's the scary thing. I just got to think when you were talking about that is, I can't imagine what statistic is out there of what even major cities don't have resources like this. Because, I mean, I know from a law enforcement standpoint, we're all taught for how to interview suspects and witnesses and victims and all that stuff, but just that specialized training that your staff has of just really taking that deep dive into the forensic side of it. A lot of places just would not have those resources.
Yeah, and we don't have them in every county in North Carolina. There are some counties that share a child advocacy center, and they're not able to do maybe quite as much as we are, being located and just serving one county, although our county is extremely populous and has a lot of need. But I think one of the things that is unique and special about us is that we really consider ourselves to be a public health response to an epidemic, which is child abuse. And so when we look at it through that lens, we're able to have just a broader umbrella of services that can fall under our scope. We have certain things we have to do because we are an accredited agency. There's a accrediting body in DC called the National Children's Alliance. and we go through accreditation with them every 5 years. So there are services we have to provide and provide well in order to stay accredited. But we do have a lot of flexibility to add on to that as we see the needs of the community evolving.
Yeah.
And that's pretty special.
Yeah. So what would you say to someone, say that parent they're in that internal battle and they think something's going on with their child and they don't know if they should call in, or, even if they're fairly certain something happened and they're scared and they don't want their child to be exposed to more trauma, they're worried about that. What would you tell them to reassure them that this is still the right step to take?
Yeah, that is so hard. As parents, of course, we want to really protect our children and diminish any harm to them that we can. One thing to know is that in North Carolina, we're all mandated reporters, and that's not the same in every state. But in our state, the law is that if you have reasonable suspicion that there has been abuse, you have to report it. And so you as the parent really owe it to your child and owe it to the community to make that report. And so that's one piece of it, is just if you think a child may have experienced abuse, you got to report it. The other piece of it, though, as a parent, and coming from a parent perspective, is really thinking about that child's future. And if this thing happened to them and you don't give them support and you don't give them services, then their physiological body is going to change. They're going to hold that stress and that trauma inside their body, and it's going to put them at risk for heart disease and other medical conditions in the future. And we know that to be true from research that's been done. But also just their sense of well-being, their ability to trust people, their ability to build relationships in the future is going to be diminished because they have this trauma that happened that's been unprocessed. And I think the other thing to look at from the flip side is if something didn't happen, then it opens the door for you to have a great conversation with them about boundaries. And whatever it was that pinged that suspicion in your mind, if it's proven not to be true, well, that's okay. Then you can talk to your kid about body safety, boundaries, online safety, making sure they're not exchanging inappropriate pictures, all of those conversations we need to be having with our children. It's just another way to walk through that door with them.
Speaking of that, do you all offer kind of that initial talk resource, or where's a good place you could steer a parent? They're worried about the online access and stuff like that.
Gosh, I have a 13-year-old and an almost 16-year-old, and I worry about it every minute of every day. It is such a scary world. Yeah. But yes, we do have a lot of resources on our website. We have some articles on there, but we also have a list of the trainings that we provide. We do an online safety training. We've got some great, printed resources we can share. We can do calls with churches, Sunday school groups. We're actually talking to an elementary school right now about doing a series for them about online safety and how to protect their children's phones and that sort of thing. So we're very flexible and able to tailor our workshops to the audience and can create things. We have lots of resources, and so when people come to us and ask about a certain topic, we're able to create that for them if they need it. But yes, on our website, there's a couple of different online trainings that people can do just about kind of abuse awareness and body safety. We provide a really wonderful evidence-based training called Stewards of Children, which is wonderful for people who are volunteers in a child-serving organization or who might run one. That's, Girl Scout troops, sports teams, churches, Sunday schools, any of those kinds of programs where you have adults working with kids that aren't their own children. We also do, like I said, online safety. We do child abuse recognition and response. I do a lot of the clinical training, so trauma-informed care. We talk to, people like you all in law enforcement about secondary traumatic stress and the impacts of that. So we really run the gamut with our prevention services. Right.
Well, I want to thank you so much for spending the time to give us a lot of information. It's really good. That was exceptional. I was like, wow, you're really prepared for it. I like that. And so I hope that helps anyone that's watching or listening to take that first step and to donate to you guys if they can to help out, because it's an amazing organization, and we can't tell you how much we appreciate your partnership, because you've helped so many families just in Matthews alone. I can't imagine how many throughout the greater Charlotte area, so we very much appreciate that.
Thank you. Yeah. Thanks for the opportunity. I always love to talk about Pat's Place, and we're celebrating our 20th year here in Mecklenburg County this year, so there's lots of great things going on, lots of great ways to support the work that we're doing. So I appreciate you asking that question, because sometimes we forget to say that part.
Yeah.
But we are a nonprofit,
You
so
have to keep the lights on. Yeah.
Absolutely,
Yeah.
absolutely.
Well, thank you so much.
Thank you.
All right.